What is a point-of-care tool? How to use DynaMed and UpToDate. A point-of-care tool is a clinical resource that is easily readable and quickly accessible for healthcare professionals needing to make informed and evidence-based decisions on the treatment and/or management of patient diagnosis during bedside care. You need a point-of-care tool because sometimes you may have a patient with a certain diagnosis and need information fast. Point-of-care tools help you make evidence-based decisions by providing you with filtered snippets of very long research articles on how to best treat your patient. UTEP subscribes to 2 point-of-care tools. We subscribe to DynaMed Plus and UpToDate. We have 2 point-of-care tools because DynaMed Plus is endorsed by the American Medical Association and it has a mobile app. This is perfect for those quick glances when you need to look at evidence information. UpToDate is a point-of-care tool that most hospitals in this area are subscribed to, but there is no mobile app access. This is a resource that you will have access to and you will be familiar with during your clinicals. Let's head on over to our nursing research guide. This is our nursing research guide. On the left-hand side, you'll see a navigation menu. I'm going to click on the third tab down that says Point-of-Care Tools and Clinical Information. Here you can see the images for both DynaMed Plus and UpToDate. The link to access them can be found below the images. I'm going to click on DynaMed Plus. And before I show you how DynaMed Plus works on a desktop, I want to talk about you installing it onto your mobile device. You will have to download the Global Protect VPN mobile app onto your phone if you want to download the DynaMed app. You may have heard about the Global Protect VPN earlier in the session from another librarian. There is a Global Protect VPN for your desktop and there's a Global Protect VPN for your mobile device. You can get help with downloading the Global Protect VPN mobile app from the Technology Support Center. Once you install the Global Protect VPN, you connect to it, then you head into your App Store or your Play Store and download the DynaMed Plus app. Then you can register and sign in. You only have to do this once, and you don't always have to be on the VPN to connect to the app. You only have to be on the VPN the first time that you register and sign in. If you have any questions about this, I will give you our contact information at the end of this video. Now, before I move into DynaMed and show you how it works, I want us to look at question number 4. It's asking us, the patient is diagnosed with community-acquired pneumonia. What interventions will be applied to this patient? Provide recommendations from both DynaMed and UpToDate. There is also a follow-up question. How do you know these interventions are evidence-based? Now, DynaMed has a search bar. It doesn't work like a database. We recommend that you use DynaMed by just plugging in the diagnosis. So I'm typing pneumonia. We know that we have an 80-year-old patient and he has community-acquired pneumonia. So DynaMed gives you suggestions. I'm going to click on this last one that says community-acquired pneumonia in adults. This is the topic page for community-acquired pneumonia in adults. At the top, you'll see it says topic, images, and updates. On the left-hand side, there's also a navigation menu. As you scroll through, you start to see a lot of bullet points. Also, as you scroll through, you'll start to see that the navigation menu is moving with us. This is the management of community-acquired pneumonia in adults. Now, oftentimes, you'll see the words management, treatment, or intervention to talk about how to treat the patient. I just want to make that a clarification because when we move into UpToDate, you'll see a different word for the management. So just know that management, treatment, and intervention are all the same thing and they all mean how to treat the diagnosis. Here under management, we can see that they have bullet points for recommendations for antibiotic therapy. They have a bullet point for options for outpatients. They have more bullet points down here for options for inpatients. So depending on the setting of the patient, you may have to treat them differently, or you may have to manage diagnosis differently, or you may have to do different interventions. Now, I know that this information looks like bullet points. How do I know that the information I'm looking at is evidence-based? I know that because if I scroll down in our navigation menu, I can see that there's a references section. If I click on that section, it will take me to all the references that were used to write up this information. Now I'm going to move out of DynaMed and head into UpToDate. UpToDate will always ask you to sign in whether you're on the VPN or on campus or off campus. It will always require you to sign in. This also has a search bar where I'm going to type pneumonia. Now, their suggestions are not very specific, but once I click search, I can see that the search results are very specific. It's also organized a little bit differently from DynaMed. At the top, you'll see an all search results. There's a button to look for only adults. There's another button for pediatric. This patient button is those patient care sheets that you would send home with patients once they're discharged. And this graphics button works like a Google image search, and I'm not going to click there because I don't want to see any lungs with pneumonia. So I'm going to click on adult because we're looking for pneumonia in adults. And I'm going to scroll through. I'm going to click on Overview of Community-Acquired Pneumonia in Adults. And we can see that it's structured similarly to DynaMed. There's a navigation menu on the left-hand side. If I scroll through, the navigation menu moves with me. I again see more bullet points. It is a little bit more narrative than DynaMed, but the great thing about this is that I know this is evidence-based information because within the information they have their citations. So if I click on this number 4 and open it in a new tab, UpToDate is going to show me the citation and the link of where they acquired that information. If I open up another one, it will show me again the citation. This one has a citation and it includes the abstract. If I want to see all the references, I can scroll down to the references section and it will list all the references that they used. Now, in DynaMed, we saw management of pneumonia. In UpToDate, we see the word treatment. They both mean the same thing. Now, to answer question 4, there are many treatments for community-acquired pneumonia in adults. To answer the question, you will only need to choose one. So I noticed that there are several bullet points on treatment. Pick whichever treatment you want, but only one, and paste it into its respective box. Also, answer the question, how do you know these interventions are evidence-based? I mentioned it several times throughout the video. If you need help or need assistance, please call us at the number, text us at this number, or reach out to us on this website.